All right. Hi, everyone. Thank you for joining us for this human papilloma virus vaccine webinar. We have two pharmacy students here today presenting. We have Christopher Kaneko, who is a third-year pharmacy student from Oahu, Hawaii. He completed his undergraduate degree at Missouri Valley College in business management and accounting. In his free time, he enjoys going to the gym and the beach. We also have Clayton Lagme. He's also a third-year pharmacy student from Oahu. He completed his undergraduate degree in healthcare administration at the University of Hawaii West Oahu. In his free time, he enjoys hiking, going to the beach, and hanging out with his friends and family. So welcome.
Okay, thank you so much for joining us today for our presentation on the human papilloma virus or HPV vaccine. My name is Christopher Kaneko, and presenting with me today is Clayton Lagme. Next slide. What is HPV? HPV is the most common sexually transmitted infection or STI. In 2018, there were about 43 million HPV infections occurring most in people who were in their late teens and early 20s. There are many different types of HPV. Some types can cause health problems, including genital warts and cancers. But there are vaccines available that can stop these health problems from happening. Next slide. For our statistics, HPV infections are so common that nearly all men and women will be infected at some point in their lifetime. Currently, as of October 2020, nearly 80 million Americans are currently infected, and about 14 million Americans, including teens, become infected each year. For most cases, 9 out of 10, the infection will go away within 2 years. More than 9 of every 10 cases of cervical cancers are caused by HPV. More than 4 out of every 10 cases of cancer caused by HPV occur among men, which is why vaccination is so important in both males and females. Next slide. In this bar graph, it compares the different prevalence and incidence of sexually transmitted infections in the US in 2018. For those of you who don't know, prevalence is the number of infections, whether it's new or existing, at a given time. Incidence is the number of new infections which are diagnosed or undiagnosed. As you can see, HPV, when compared to other STIs, including herpes simplex virus, trichomonas, chlamydia, HIV, gonorrhea, syphilis, and HIV. HPV infections are more than double of any other STIs. Next slide. For the most common HPV cancers, HPV can cause various forms of cancer. Here is the breakdown of the most common HPV-causing cancers by sex. In females, it's cervical, anal, or oral. In males, it's going to be oral, anal, or penile. Cancer often takes years, even decades, to develop after a person gets HPV. The types of HPV can cause genital warts are not the same as the types of HPV that can cause cancers. There is no way to predict who will develop cancer or other health problems in those who have been infected with HPV. Next slide. On this other bar graph, it's comparing the number of HPV-associated and estimated number of HPV attributable cancer cases per year. In green is going to be the newly diagnosed cancers for each cancer type. And in blue is the number of those cancers which are associated with HPV. For cervical cancer, HPV cancers cause about 91% of them. For vaginal, it's going to be 75%. Vulva, it's 69%. Penile, 63%. Anus is 91%, and oropharynx is 70%. These numbers are reported through CDC as of 2016. For our next slide, how is HPV spread? You can get HPV by having vaginal, anal, or oral sex with someone who has the virus. It is most commonly spread during vaginal or anal intercourse. HPV can be passed even when an infected person has no signs or symptoms. Anyone who is sexually active can get HPV even if you are sexually active with only one person. You also can develop symptoms years after you have sex with someone who is infected. This makes it extremely difficult to know when you first became infected. Next slide. This is why it's important to get vaccinated. The HPV vaccine is safe and effective. It can protect against diseases, including cancers, caused by HPV when given in the recommended age groups. Get screened for cervical cancer. Routine screening for women aged 21 to 65 years old can prevent cervical cancer. If you are sexually active, proper use of a latex condom. This can lower your chances getting HPV, but be aware that HPV can infect areas not covered by a condom. So condoms may not fully protect against HPV. You would also want to be in a mutually monogamous relationship. Next slide.
Okay, so here, this map shows HPV vaccination efforts in adolescents ages 13 through 17 by state, which is current as of 2019. Hawaii is amongst the few states with the highest vaccination rates in the nation for this age group. In 2016, Hawaii's vaccination rate for this age group was 64.8% and 79.4% in 2019, indicating that a large opportunity for vaccination still exists among adolescents. Next slide. Okay, so this here, the graph on the left of your screen shows the percentage of men and women aged 18 through 26 who have received at least 3 doses of the HPV vaccine. This study was conducted in 2018 by the Behavioral Risk Factor Surveillance System, which reported the percentages of men and women ages 18 through 26 who were vaccinated against HPV, which was 32.4%, indicating a big area of opportunity for vaccination in this age group. In response to the vaccination rates, Hawaii lawmakers introduced Hawaii Senate Bill 514, which helps increase public access to the HPV vaccine. HSB 514 was introduced in 2017, which authorizes pharmacists to administer HPV vaccinations to people between the ages of 11 through 17. In addition to HSB 514, Hawaii lawmakers also introduced Hawaii Administrative Rules, Chapter 11-157, which became effective July 1st of 2020, which requires all students to meet minimum immunization requirements before they attend school in the state. HPV is amongst the various vaccinations required by the time the student enters the 7th grade. Next slide. So this here is a Gardasil vaccine. So Gardasil 9, also known as 9V HPV, which is the only HPV vaccine available in the United States. The vaccine covers 9 different types of HPV vaccine, HPV types, which includes type 6, 11, 16, 18, 31, 33, 45, 52, and 58. Type 6 and 11 are common HPV types that are linked to causing genital warts. And type 16 and 18 are commonly associated with causing 66% of cervical cancers and the majority of other HPV-associated cancers in both women and men. Gardasil 9 also targets 5 additional cancer-causing types, which causes about 15% of cervical cancers. Next slide. So what are some reasons why we want to vaccinate early? We want to vaccinate people early, especially while there is very little risk of exposure to HPV, especially before the age of 13, because the risk of exposure increases afterwards. Also, because the vaccine has been proven to be most effective at preventing HPV-related cancers before exposure. The HPV vaccine is only one of 2 vaccines that can prevent cancer, and also because there is no current HPV status test. Next slide. So if you're still on the fence about vaccinating your child against HPV, consider these 6 additional reasons. First, HPV is a common virus that infects both men and women. 80% of people will get an HPV infection in their lifetime. HPV vaccination has been proven to work. Vaccination has helped decrease infection with HPV types that cause HPV-related cancers and genital warts in 71% of teen girls. HPV vaccination also prevents cancer. More than 29,000 HPV-related cancers can be prevented just by getting vaccinated. Why risk cancer when we can vaccinate against it? Fourth, prevention of cancer is better than treating cancer. It's 2 or 3 shots, depending on when you first start your vaccination series, versus multiple rounds of possible cancer treatment. The HPV vaccine is a tool in cancer prevention, keeping in mind that the only type of cancer screening available for HPV-related cancer is cervical cancer screening. Fifth, the accessibility to HPV vaccine has become more accessible than ever before. Many healthcare facilities and pharmacies are now a one-stop shop for all preteen vaccines. Your child can get their HPV vaccines at the same time as other required vaccinations, such as meningitis and whooping cough. Lastly, preventing cancer is easier than ever before. Studies have shown that 2 doses of HPV vaccine provide similar protection to that of 3 doses when given before the 15th birthday. Next slide. So we'll take a look at the vaccination schedule. So who gets 2 doses? Those who are ages 9 through 14. So a 2-dose schedule is recommended before their 15th birthday. In a 2-dose series, the second dose should be given within 6 to 12 months after the first dose, with a minimum interval period of 5 months between the first and second dose. Next slide. And who gets a 3-dose series? So 3 doses series are for ages 15 through 26. So it's recommended for people who get their first dose on or after their 15th birthday, and for people with certain immunocompromising conditions. In a 3-dose series, the second dose should be given 1 to 2 months after the first dose, and a third dose should be given 6 months after the first dose. Next slide. And who should not get vaccinated? So people who've had a life-threatening allergic reaction to a vaccine component or prior dose of the HPV vaccine. Those who have had an allergy to yeast, and those who are pregnant. However, if you become pregnant during your vaccination series, you can wait till you are no longer pregnant to complete the vaccine. Some notes to take here are moderate or severe acute illness is a precaution to vaccination, and vaccination should be deferred until symptoms of the acute illness improve. And a minor acute illness, such as diarrhea or upper respiratory tract infection with or without fever, is not a reason to defer vaccination. Next slide. So lastly, myself and Chris would like to thank all of you for attending our webinar on HPV. At this time, we will take questions you have for us.
Thank you, Chris and Clayton. If there are any questions, please type it into the Q&A at the bottom of your screen, and we will go ahead and read it out loud to the panelists. But first, I have a question here. Can you get infected by more than one type of HPV? So if I have genital warts, do I still need to worry about cancer?
Yes, you can get infected by different types of HPV. It is still recommended. It is recommended that even though you are sexually active, you may be infected with just one type of HPV. So it's still recommended that you get vaccinated because the vaccine covers the other different types of HPV as well.
Thank you for that. Also, can a woman who is breastfeeding receive the HPV vaccine?
Yes. studies have proven that breastfeeding while receiving the HPV vaccine is okay.
Okay, and then I have another question. So this person asks, if as a man, I got one of the older versions of the HPV vaccine that were not indicated for men, like Cervarix, do I need to get vaccinated again?
Yes, you do. Cervarix actually, males that were administered with Cervarix should be revaccinated because Cervarix is not approved or recommended for the use in males. So it is recommended that males who receive Cervarix to get revaccinated.
Is that true also for women who received one of the older versions like Cervarix or Gardasil with the lower number of protection against the different valents?
Currently, there are no ACIP recommendations for additional doses of the 9-valent in persons who have started the 3-dose with the 2-valent or 4-valent.
All right, are there any other questions? Okay, if there are no questions, then thank you very much, Chris and Clayton, for teaching us about HPV vaccine. Okay, thank you.
Thank you.
Thanks, everyone.